You all having a good night or good weekend?
Yes. What about you?
Good. It's good. All right. So 152 exam one. All right. Not over. Can you guys see the PowerPoint? All right. So we'll start with the nursing process. So who does what? So we know with the nursing process, the registered nurse is going to have an independent role, right, in all parts of the nursing process. And so with LPNs, the LPN can independently do the data collection, right, and implementation. So assessment is RN. The LPN gathers data independently and reports findings to the RN. Um, the RN will do the nursing diagnoses using the NANDA eyes. Then planning, the RN and the LPN will collaborate together. And then implementation, right? The RN and the LPN both carry out orders independently. And then the evaluation, excuse me, the RN does that, but the LPN will report recognized findings to the RN. So again, the RN does all five uh, all five steps of the nursing process independently. The LPN can do the data collection and the implementation independently. And then the other three steps, they will collaborate with the RN, right? Um, so again, the LPN functions in an independent role in the nursing process by collecting data and implementing interventions. The RN creates the nursing diagnoses. The LPN collaborates with the RN on the plan of care and evaluation of client outcomes. Safety is always the priority nursing intervention for the client, right? So we always have to think safety. And then before collaborating on the plan of care with the RN, the LPN must assess the client's understanding first, right? So before we can collaborate on the client plan of care, we have to know, right, what does the client understand about their condition? What are their priorities for change, right? What do they want to see? What do they think is important? So, the LPN will most often reinforce client teaching. So the RN does the initial client teaching, right? So RN will always do the initial client teaching, and then LPN reinforces that teaching and then notices, they notice changes needed to the plan of care during implementation phase of the nursing process. Right? Because we're LPNs, you're going to be working with the clients, giving their meds, doing their treatments, right? All that good stuff. So you're going to notice the changes so that you can report them back to the RN, right? So any necessary changes that need to be made to that plan of care can then be implemented. Nursing interventions are patient specific, right? So we're writing that plan of care for our clients. Um, and we're setting up that, their goals, their interventions, they're specific to the patient, what the nurse will do to assist the client in reaching goals and identified outcomes, right? So working with the client, we understand what their goals of care are, right? We're going to choose interventions that are specific, that we are going to work with that client in order for them to reach their goals and their identified outcomes. So when we look at outcomes, right, we know when we're writing outcomes, they need to be SMART goals, right? So they need to be measurable, they need to be realistic, and they need to be time specific, right? So realistic, attainable based on their condition and desires. Measurable tells you how you will know that the outcome has been reached, right? So, and then time specific, right? An educated guess on how long it will take to achieve that outcome. So let's say we have a patient that has had a hip replacement, okay? And so a an outcome would be patient will walk 25 feet, right, by post-op day 2, right, or post-op day 3, right? So it's measurable, it's realistic, and it's time specific. Data collection, we collect subjective and objective data. So subjective data, right, that's what the patient tells us. It can often be more difficult to measure, right? But always think of subjective information as symptoms, right? My pain's a 7, I feel nauseous, I'm hungry, I feel sad, my big toe hurts, I have a headache, right? Those are subjective, then there's symptoms, right? Whereas your objective information are signs. These are data that the nurse can verify, right? So things we can see, we can touch or feel, we can hear, we can, what I miss, see, smell, touch, right? We're using our senses. So vital signs as well are objective measures, right? Because we can get numbers to quantify that. Skin trigger, color, wound appearance, their level of consciousness. Your objective data also could be, height and weight. It also could be lab results, x-ray results, right? Things that we can verify. So subjective, again, those are symptoms that the patient is reporting to you that can sometimes be very difficult to verify. Objective information, these are signs, these are things that we can verify using our senses or even quantifiable, like your vital signs, your lab results, those kinds of things. We look at critical thinking. So critical thinking, the scientific principles behind critical thinking. Um, there are specific steps that we gather, so or how we get, how we get our information. And so the first thing is collecting data in a organized way. So this something too that may often take some practice, right, in how we collect data. In data collection, when you're doing your head to toe assessment, just, trying to keep it organized. Verifying that data as well is important. There's, we can look, when we look at verifying data, we can look back at um, their hospital records, their, other medical records. It also could be even asking, family members or other members of the healthcare team or, other staff involved. There's any kind of, what's the word I'm looking for? If it doesn't match, right? Um, then we also want to arrange the data in an organized way. And this helps us to trend data. So, you're taking vital signs every 4 hours, right? And we have it arranged in that organized way. It helps us to look back at those records, those blood pressures to see if, there's any significant changes, right? Not just for blood pressure, but for any data that we're collecting. And then we want to look for any gaps in information. So gaps, going back and trying to find out what data is missing, right? So that we can fill in the gaps with what is missing. And then we analyze the data, right? And then we test it out. And that is it's purposeful, it's outcome or goal oriented when we're testing it out. Critical thinking. So when we look at critical thinking, what is critical thinking? Tell me what critical thinking is to you. So critical thinking is purposeful, informed, outcome-focused thinking that requires careful identification of problems, issues, and risks, right? It's driven by the client, it's driven by the family. It's based on the nursing process, as well as scientific methods. It uses both logic and intuition, right? Based on knowledge, skills, and experience. Um, it's guided by professional standards. And it's, constantly reevaluating, self-correcting, striving to improve. And so examples of critical thinking: noticing a change in patient's condition, right? So nurses are the ones at the bedside. We're the ones that spend the majority of time with our clients, right? So we are more likely to notice any subtle changes in our clients. So that would be an example of critical thinking, right? Noticing a change in their condition. Questioning a medication order that is unusually high. So, where you work and what you do, you're going to get very familiar with the medications that you're going to see. If something doesn't look right, then you want to look it up. If you don't know what a medication is, you don't know if what the standard uh, dosage is, look it up. Okay, there's plenty of drug references that are there. And I know that there's other safeguards in place, right? But it's our job. We're the ones that are going to be given the medication. So always look at that. Um, Prioritizing patient care is another big part of critical thinking, right? So you get on your unit, you get report, and you get a list of all your patients and what's going on with them. How do you know who to go see first, right? So which client is going to require your immediate assistance versus one that is a little bit more stable. Adapting to unexpected issues is also an example of critical thinking, right? So, oxygen delivery system failure. What happens if the oxygen in the wall doesn't work anymore? What do you do? What if the power goes out? What if the computer system goes down? Right. So, what are you going to do in those situations? Determining that a pain medication is not adequate for a post-op patient. That goes kind of question, it's a medication question, right? And so if the medication isn't helping, right, or it's not, a good dose, right, then it's our job, right, to advocate for our clients. Um,
So you're saying that critical thinking basically it's about collecting your data, and you want to analyze your data. You want to get information to be able to make like a sound clinical judgment, um and you want to have like different decisions on what you're doing, who you want to ensure your patient's safety, right? Because something I was reading, it says safety had like one of the highlighted things, like safety is always first, safety is always first, safety is always first. And then you
yeah.
break it down, like just say like if you have four patients, you want to see who you want to see first. You want to see the acuity of the patients, like who needs needs it first. I'm sorry, I'm on grandma duties right now.
I see. That's okay. I'm like, I can hear it. She's so cute, or he's so cute. I don't know. I can just hear
Kitty.
him.
So, then once you ensure the patient's safety, you want to see the effectiveness. And I heard you say something on one of the slides. We want to make sure that it's patient-centered care, like is what the patient says. But if the patient can't express what they says, then we go back to the history of asking the family and verifying the data that we need.
Very good. Absolutely. Yep, you got it. Good job. Yep. All right. So cognitive thinking. We look at cognitive thinking levels and examples. And so knowledge refers to the ability to recall and repeat information that you have memorized, right? So, there's 206 bones in the body. I don't know why I always that just came up, but that's a knowledge, that's a recall, it's memorization, right? Or, normal potassium levels are 3.5 to 5 milliequivalents per liter, right? Those are recall or memorization questions. Memorizing is not the same as understanding, right? Because I can memorize data all day long, but if I don't know what to do with that, then, that's so memory or knowledge is just recall and memorization. Comprehension, that is the ability to basically understand information, recall it, and identify examples of that information, right? So you understand, right, what is going on. And so one example of comprehension is the ability to repeat something in your own words, right? So this kind of goes, think about like when you're writing a paper, right? And you read the information in an article in your textbook, and now you want to put that information into your paper, right? But we're not going to use the direct quote. We can't use the exact words, right? We have to be able to turn that information around to put it in our paper. But in order to do that, you have to understand what it's saying. Application is being able to use learned material in new situations, right? So, what your knowledge is, what your comprehension is, right? Now you need to be able to apply that information, right? So, being able to prioritize, just like you were saying, Tasha, right? Which client do I go see first after I get reports? We know what's important, what's the first thing that I need to do. Application is a higher level of understanding, right? So you must be able to use your knowledge, right? So that you can tailor your approaches to the specific situation. Analysis means being able to break down complex information into its basic parts and then relate those parts to the big picture. Okay, so again, this too is the ability to organize and prioritize. It's, what is, even we look at safety, right? So you go into a client's room and, they're on the floor. Well, how did they get to the floor, right? So you start looking around and you start, kind of looking and seeing what all the different parts are, how that person got on the floor. And now we can, even go, okay, now what can we do to prevent this from happening again, right? So that is example of an analysis. You're breaking down those parts into the basic part, or you're breaking down the information into the basic parts and then relating those to the big picture, right? So maybe his call bell wasn't in reach. He had to go to the bathroom, but nobody was, paying attention. Or, maybe he slid off the bed or, whatever. So you're kind of breaking it all down and then putting it back together to fix it, right? So this one kind of puts it back together. So knowledge, again, potassium, normal potassium, 3.5 to 5 milliequivalents per liter. Comprehension would be, what does it mean if the client is hypo or hyperkalemic? Application would be, what do I do with this information, right? How do I care for the client? And then analysis is, how does what I do impact the client overall? So how nurses make decisions. And so we have the Tanner model. And so the Tanner model is a way to just kind of show us, how everything is broken down. So it kind of all goes. It's nurses' knowledge, experience, ethical perspective, knowing the patient, right? So we notice something that is changed, or something that is different. So that's like I said, the patient is on the floor. Like, how did they get there? Or, the patient is, his potassium level is 3, right? So it's noticing, right? It's you look at the situation, you gather your data, you look at patterns. Interpreting is where you're making sense of the data that you've gathered. You're analyzing it, and then you're, forming an understanding of that patient's condition. And then you're responding, right? So what do I do? Right? My patient's on the floor, what do I do? If my patient's potassium level is 3, what do I do? Right? And then reflecting, you're going back, you're looking at your client's response, you're looking at your actions, right? You're remembering, you're learning for future reference, right? So this is, just a framework that, it's what is it? The 4 phases of clinical decision making. So noticing, interpreting, responding, and reflecting. So you see something wrong, you try to make sense of it, you analyze it, and then you respond. So your respond is your actions. What am I going to do? Right? What implementations am I going to put into play? And then reflecting is your evaluation, right? So how did my actions help? You know, and or how did my actions not help, right? What can I do better for the next time? Much like the nursing process, right? Much like the nursing process. Then we have our ethics. And so ethics is the system of standards or moral principles that divide our actions as either being right or wrong, right? And so it, we all, you know, um, what actions are right or wrong, um, if one has the right to do something, if one has the duty to do something, if one ought to do something, right? Am I supposed to do something in this situation? Right? So it's concerned with the ways people, whether individually or as a group, decide on those, again, what actions are right or wrong? Do I have the right to do something? I have the duty to do something. Should I do something? We look at professional versus personal ethics. So, personal ethics, those are your personal guidelines, right, for living. So you choose, right? Nobody can choose those for you. You choose what your personal code of ethics is. And so your personal code of ethics will influence your nursing ethics. And then sometimes personal ethics will conflict with the law, which is our State Nurse Practice Act. And so when our personal ethics conflict with the law, we have the obligation to follow the law, right? So, I think I talked about this a little bit in class, right? If you're working in the emergency room or anywhere, right? And you come across a client who, um, had a procedure. I'll just use the one that I like because it's easier, but You're working in the emergency room and a client comes in and he was the perpetrator of a mass shooting and he got wounded in the process and he has to get care. And he comes to your emergency room and you're there and you know what he did because of course it's already been on the news, right? What do you do? Right? What do you do?
You still
We have
gotta
obli
treat him because you gotta treat even
everybody the
even
same.
though yeah, you have to treat everybody the same. You can't use your personal ethics of the way you feel. You have to go with what the the nurse practice act consider. You got to treat every patient as a whole, even
Right.
though you have your own personal ethics or whatever. Like he killed somebody, he should die. You can't use that because then you will be held at a standard. You got to use your morals and values of what's right and what's wrong.
Very good. Yep. You have an obligation. Take an oath, right? We're going to care for clients regardless, right? And so, yeah. And I know I've said this before, but I hope that you never have to be in that situation, right? But it is something. We can't refuse nursing care, right? We take an oath and, it is our job to take care of patients. And so some of the ethical responsibilities of nurses, we have advocacy, accountability, um, colleague reporting, and system-based issues. Sorry. So client advocacy. So that is one of a big role of us. And in addition to education, client advocacy is role for all nurses. And so we see patients at some of the best days of their lives, some of the worst days of their lives, regardless of the situation. Okay, whether they're having a baby or they are in a major trauma, so good or bad, right? They are still in a vulnerable situation and they need nursing care. And so we need to advocate for our clients. And remember, knowledge is power, right? Knowledge is power. And so making sure that we are providing our clients with all the information that they need, regardless, their disease process, their medication, their treatment options, all of those things. So again, in knowledge is power, giving them information. And there also may be times where, if, like we were talking about earlier, I'm going to go back to that slide. Where to go? Examples of critical thinking, right? Questioning a medication order that is unusually high, or determining that a pain medication is not adequate for a post-op patient. Both of those, right? That's advocating for your patient, right? You're not going to give somebody a medication where the dose is too high and you could potentially cause harm. Or the same thing, if we're not giving somebody adequate pain medication, right, then they're not going to be able to do what they need to do to get better, right? They're not going to be able to turn, cough, and deep breathe. They may not be able to get up and ambulate like they need to do, right? So we have to advocate. Um, and then part of that advocacy too is when they make a decision that we, you know, support their decision, right? Whether we think, and I'm gonna say it that way, whether we think it's the right decision or not, okay, it's their decision because we've given them all the information, right? We've given them the education, the knowledge, the resources for them to make that informed decision. And once they make that informed decision, then regardless of how we feel about that decision, we have to support them. Accountability. Accountability means that you're answerable to yourself, to your client, your supervisor, the rest of the healthcare team, all of those people. And so you're held accountable for your nursing actions. And so the measures for accountability, that is our nursing standards of practice, right? And so we hold ourselves accountable. Colleague reporting is another ethical responsibility of nurses. And so this is reporting peers, it's reporting supervisors, or any team member for behaviors that are potentially harmful to clients. So, did they come to work, high? Did they come to work drunk? Are they stealing client medications? Are they replacing medications? Are they not supervising their clients like they should be? Are they sleeping? Right? Are they abusing verbally, physically, whatever? So we have the duty to report them. Again, client safety is key. And then system-based issues. So identifying system-based issues, right? That's essential for providing high or safe, high quality care. So new procedures, if they're implemented without the appropriate education and training, then you need to notify administration, suggest a plan of action, right? Night shift. I always use night shift as an example because we usually get pushed to the side, right? We don't always get all the education. We definitely get what the leftover pizza, right, from day shift. Um, but I always use night shift as an example because, educators aren't available at night. A lot of your administrative staff aren't available at night, right? And if you have a new procedure, a new policy, a new piece of equipment that you're required to use, but you've not been trained on how to do it, you can't use that safely and you could potentially cause harm to your clients, right? So, bringing that to light is also very important. Our ethical principles, oops, sorry, are your non-maleficence, your beneficence, your autonomy, your fidelity, justice, and then of course we have veracity, which is your truthfulness. So non-maleficence means to do no harm, okay? And so this is, following your rights on medication administration, doing your 3 checks. It's even, when you get ready to leave a room, it's making sure that the bed is in the lowest position, the call bell is within reach. Um, making sure that you're providing care for clients, even when their ethical principles, right, conflict with yours. Beneficence is right to do good. And so this is the basis of trust in nursing. It also involves preventing harm and removing harm. And so, not going off duty until you have handed over your care and you've done a turnover with the nurse that is relieving you, right? It's if you give the wrong medication, it's making sure that you report it as soon as you recognize it. So it's placing the good of clients before your needs. Autonomy is the freedom to choose. That includes privacy. So kind of talked about this a little bit with advocacy, right? Autonomy means that they get all the facts, they think through all the facts, they decide um, what their course of action is going to be. They act on a personal decision and they make that decision without pressure from anyone else, right? So it's giving them all the information that they need in order to make an informed decision. It also does include, your privacy. Privacy is both a legal as well as an ethical issue, right? So autonomy does include their right to privacy. And then your fidelity is to be true. Um, and so, what does it mean to be true? Um, it's acting again in the client's best interest when the capacity to make free choices no longer available to that client. All right. So, when we look at things, it's also, making sure that we differentiate between our feelings and choices regarding an issue and the feelings and wishes of the client as well, right? And making that decision, but it's being true to your clients. So things that would fall under this also includes HIPAA. So autonomy includes privacy, fidelity includes HIPAA, right? So things like not talking about your clients in the elevator or the cafeteria or in the hallway where other people can hear you. It's not letting somebody else talk bad about clients, right? We all know room six, a pain in the butt, right? They're going to be on the call bell all 5 minutes, every 5 minutes, and all they really want is just a sip of water. Okay, that doesn't make them a pain in the butt. It makes them thirsty, right? And so maybe we need to look at some interventions to help them get enough fluids, right? Um, and so HIPAA is really important, right? We want to make sure that we don't disregard HIPAA, that we maintain their privacy. And justice, right? Fair and equal treatment, regardless, right? So recognizing and avoiding any personal bias, right? So always, putting your personal bias aside and caring for your clients. Beneficent paternalism. Beneficent paternalism is a disrespectful attitude toward a client and what the client has to contribute to personal care and recovery. It's an I know what's best for you attitude that discounts the client's knowledge of self. All right. So this could even, like an example would be developing your plan of care without having any client input. All right. That would be beneficent paternalism. Um, we don't do this. Okay. The only time beneficent paternalism is justified is in an extreme circumstance, and it most often it's a medical decision. So we can go to court, get a court order to save the life of a child against parents' witnesses or parents' wishes, right? So there have been times where parents have refused potentially life-saving treatments or procedures for their children. And in those situations, the facilities can go and get a court order so that they can administer those life-saving um, procedures. Trying to think. And I think there's been some cases on the news where parents have refused like cancer treatments and things like that for their children, where they've had to go and get this. So generally speaking, it's a disrespectful attitude, but in an emergency situation, it can be used. Legal aspects of nursing care. So when we look at legal aspects, the state statutes that apply to licensed persons and situations in client care that could result in legal action, where can you find them? So, one, your organizational rules and regulations. So, anytime you go and get a job, there are policies and procedures, there's rules and regulations that you have access to from your employer. Make sure you read through them. um, and know, if there's a policy, make sure you read a policy before you go through with something. What are your obligations under the law? So I always think of their Nurse Practice Act. Your professional groups like NAPNES is another place where you can get some information regarding legal aspects of nursing care and policy and procedures, of course. So again, rules and regulations, policies and procedures, your professional organizations, and then your Nurse Practice Act. So the minimal competencies required to practice safely. So your minimal competencies is your state Nurse Practice Act. And so it's really important to know your scope of practice. Even with when we look at um, what is it, the multi-state licenses, right? You can practice in a different state. So if you live in Florida, you want to work in Alabama, you live in Ohio, you want to work in I don't know what's next to Pennsylvania. You work in Pennsylvania, you want to work in Jersey, like wherever, right? You have to know not only your Nurse Practice Act, but you have to know the state that you're working in. So if you're crossing state lines and you're going into another state to work, you need to look at their Nurse Practice Act. You need to know what your scope of practice act. You don't, if you not knowing what's in your Nurse Practice Act is not going to protect you if there's any legal proceedings regarding your license. You can't say, oh, I didn't know, because it is your responsibility to know what your Nurse Practice Act states. So content of the Nurse Practice Act. And so it's going to list the general procedures, the licensure process, um, the elements of unprofessional conduct, information related to reasons for a suspended or revoked license. It'll also include the impaired professional program, responsibilities of the Nurse Practice Act. It's going to list the general functions of the licensed nurse. So, what are the functions of LPN, LVN? What are the functions of the RN? It will also provide the definition of nursing, and there are specific definitions for both LPN, LVNs as well as RNs. It'll also provide the standards of nursing content or conduct, and then other things like organization approval and administration of nursing programs, as well as continuing education. So that brings us to the State Board of Nursing. So common functions or common board of nursing functions. So licensing and certifying. So specialty certifications can be from other organizations as well. So your NFLPN, your NAPNES, right? Depending on where you get your certification, you get your wound certification, that's a different place. It sets the fees. So how much is it to apply for your initial license? How much is it for renewal? It established the standards for educational programs. So the Board of Nursing in all of the states that Florida's, so look at Florida's college, where we operate over multiple states, right? So when they set the curriculum, right? How many clinical hours you need, how many lab hours, all of those things. They have to take all of the state boards of all of the state boards information from each state and make sure that everything goes according and that we meet the requirements in all of the states to deliver the nursing program. It approves schools of nursing. All right. So you have to be, for nursing programs to operate, they need to be approved by the State Board of Nursing. I already talked about, it determines the duration and renewal of licenses. So every 2 years, every 1 year, every 2 years. I think I don't know if anybody is every 3 years, but how often you have to renew your license. And some boards require continuing education credits for renewal of license. So it's super important that you look at your board of nursing and just, determine how many hours of the continuing education you need per year prior to, renewing your nursing license. They maintain the inactive status list. They also carry out disciplinary action for violators. They develop programs for impaired nurses. They also can suspend and revoke licenses. They deal with the appeal process as well. So if something happens, okay, if I do something wrong, what's next, right? So the complaint would be filed to the state board, okay? And then the state board is going to determine if the behavior was unsafe, incompetent, unethical, were there any alcohol, medications, illicit substances that affected the nurse's physical or mental condition? Was there a violation of the Nurse Practice Act or another law? Okay. And then once they do that, then they will do the review of the complaint. So they'll verify if and in which state the nurse is licensed, whether or not the act is regulated by the Nurse Practice Act. Okay. So is it practice related, drug related, misconduct, abuse, fraud? They're also going to verify if there's any positive criminal background. And then they'll do their investigation. And so during the investigation, there will be interviews, as well as the evidence collection. And then, oops, then they go to the board proceedings. And during the board proceedings, this is where the nurse can respond to the allegations against them. And so once the nurse has responded, then there's different things that can happen. We can do a settlement conference. They can then progress to a formal administrative hearing, or they may do an alternative to discipline program. So if it was like alcohol or drug related, they may do a substance abuse monitoring program. Some of the board action, they can do emergency action, so they can do an immediate suspension to protect the public pending a complete investigation. They can do disciplinary action, and this can be a variety of things. It could be a fine or a civil penalty. It can be a reprimand. It could be a limitation of practice, suspension, revocation, remediation, education, monitoring. So there's a variety of things that can occur. And then reporting and enforcement, NURSIS, NURSYS, that is a national database for verifying licenses and discipline actions for nurses. And then we have the National Practitioner Data Bank, and that is all adverse actions that taken against a healthcare professional's license needs to be reported to the National Practitioner Data Bank. Your nurses license verification. This is not your state board of nursing. This is a national website. Um, and so under this, the information that's going to be there is your license number, when it expires, and if you have any disciplinary actions on your license. All right, so you go to work in another state, right? Give them their license information. They're going to look you up in nurses, and they're going to see if there is any disciplinary actions on your license. Liability. Liability just means you're responsible for something. With nursing, liability in nursing is associated with civil law and includes contracts, negligence, and unintentional and intentional torts. So we have criminal. So criminal is people in society as a whole. It's a relationship between individuals and the government. And so some of your criminal acts are your misdemeanors, and your felonies. A misdemeanor is the least serious charge. It can result in a fine or a prison sentence of generally no more than a year. Um, and then your felony is a more serious offense, though, with a penalty that usually ranges from more than 1 year to imprisoned to death. Okay, so it little variety. So some of your criminal acts are homicide, larceny, embezzlement, things like that. Your civil action, this is individual versus individual. And so it protects the individual rights. It usually results in payment of money to the injured person. And so this includes your intentional and your unintentional torts. Your intentional torts is intended to harm the client, right? So either a threat or actual physical harm. An unintentional tort did not mean to harm the client, okay, but still caused injury. So again, intentional tort is intended to cause harm to the client. like a threat or actual physical harm. And unintentional is you didn't mean to harm the client. So I did not mean to hurt the client is no defense if you didn't use your six rights. You gave them medication, gave the client incorrect medication, which resulted in injury to the client. Are we good so far? Any questions? I'm sorry. I was just going and going.
No, you're fine.
I'm sorry.
You're fine.
Um, all right, so we have negligence. Oh man. Negligence is failure to use such care as a reasonably prudent and careful person would use under similar circumstances. So it's failure to act with ordinary care and injury is caused to another. So a common type of negligence is going to be your personal injury. Okay. There are four elements that are needed to prove negligence. And those four elements are duty, breach of duty, damages, and proximate cause. So, duty, that's your nurse's responsibility to provide care in an acceptable way, right? So, you have a duty based on your education, based on policies and standards of the place of employment, as well as your Nurse Practice Act. Breach of duty means that the nurse did not adhere to the nursing standard of care. So, what was expected of the nurse was not done, which is an act of omission, or was not done correctly, which is an act of commission. All right. And so, in this situation, an expert nurse witness will establish the standard of care. So, example, an act of omission. Let's say you didn't give the client his dose of antibiotic as ordered. That is an act of omission because you just didn't do it, right? Um, an act of commission or something that was not done correctly, you um, let's see, you gave the wrong dose of the antibiotic, or you gave the wrong antibiotic. That was an act of commission. Damages mean
Right.
the
Like,
client.
I'm
Go
sorry. What if
ahead.
you like say, for instance, like, oh well, give this antibiotic in like a certain part of the body, like in the arm, or and you
Okay.
do it somewhere else. Would that be the
That,
same thing?
that would be an act of commission. So, like
Okay.
your example. So, let's say the antibiotic was supposed to be given IV, but you gave it by mouth instead.
Yeah.
That would
Sure.
be an act of commission
Okay.
because you didn't do it correctly. You
Okay.
gave it, but you didn't give it correctly.
Right.
So
Okay.
yeah, good.
Mm.
Yeah. And then damages means that the client must be able to show that the nurse's negligent act injured him or her in some way. So they have to be able to prove actual damage. Okay. And then proximate cause means that there is a cause and effect relationship that can be shown between either the act of omission or the act of commission of the nursing act and harm to the client. Right. So, did giving the antibiotic by mouth instead of IV, did that actually cause harm to the clients? Okay. Not, if we didn't turn and reposition our clients every 2 hours and they developed a pressure area, right? So they have to be able to show that there's a cause and effect relationship. Malpractice. Malpractice is the legal name for professional negligence. It just means negligence by a professional. All right. So nurses are professionals, LPN, LVN, doesn't matter. The most common type of negligence in practical nursing relates to action or lack of action, not what you intended to do. So again, that's your active commission, your active omission. All right. Oh, This slide always messes up on me, but what's the difference between assault and battery? Um, and so, yeah, this slide always messes up. So battery is actually physical harm, right? Battery beating, okay? Assault is a threat, all right? So I'm gonna beat you up is an assault versus battery is beating, right? Is actually physically harming somebody.
So
Um,
the
Go ahead.
battery is actually like the action. Like
Is the
you did to
action.
find
Yeah.
yourself to do it. You actually done it. And then threat is what you just said, I'm gonna beat you up.
Right. So I'm gonna beat you up. That's assault. But then when I start beating on you, right, that's the battery. Um, like sliding out of my chair, sorry. All right. So chemical versus physical restraints. So chemical restraints are your medications, right? So you have a client that, is up, they're, in the way, they're at the nurse's station, they're getting into things, and you're like, oh, I got this. I'm going to give you some medication that's going to make you go to sleep. Okay. That is a chemical restraint. A physical restraint, those would be physically restraining your client. So wrist restraints, um, preventing them from getting up out of a chair. Um, Trying to think of what else would be considered a restraint versus, um,
Keeping them
blocking their
secluded in a
passages.
room, keeping them secluded in a room, not letting them go with different activities.
Yep. So either way, we can't use either one, right? Can't use physical, can't use chemical restraints. It's a violation of the client's rights. Libel and slander. So, libel and slander, I get these mixed up myself. So, libel, or so defamation, which is damage to a person's character, can be through slander or libel. So, slander or libel. So, slander is spoken. So, S is S. Slander is spoken. Libel is written. All right, so slander, S is S. So slander is spoken, libel is written. So obviously if I say it, right? Um, but libel can be variety. It could be sending an email to the editor of a newspaper, posting on social media. It could even be false accusations on a performance evaluation. It could even when you're documenting in a patient chart, right? Writing negative things about the patient in the patient's chart, right? So be very careful with, with those. And, we try not to, do any of that, of course, right? But, doesn't mean that it can't be done to us. And then we have HIPAA, HIPAA, the Health Insurance Portability and Accountability Act. And so the main goal or the main focus of HIPAA is privacy protection, right? So protection of the client's privacy. Clients can file a complaint if they think their privacy has been violated. And so HIPAA does require that everyone receive a notice of privacy practices. So think about it. Anytime you've gone to the doctor, usually at the beginning of the year, the first time, you see the doctor that year, you'll have to sign your HIPAA privacy practices. You go to the emergency room, whatever whatever happens, you're going to sign this. And in that notice of privacy practices, it's going to give information on how they can contact the privacy officer if they feel that their privacy has been violated in order to file a complaint. So with HIPAA, Every facility has to have a designated privacy officer that will handle those complaints. We do not handle the complaints. Like if a client comes to you and says, you violated my privacy and da 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 da, here, here's the HIPAA privacy officer. You go to him. What information can you give out? So this is something that, I remember when HIPAA first was enacted. So, I've been a nurse for a while. But what information can you give out? So clients have the right, they can look at their medical records, they can review their records upon request. And each facility determines the conditions the records can be reviewed. It's a lot different now. Everybody's got a patient portal, right? And everything goes into your patient portal. So you can pretty much kind of just log in and see everything. Um, but the nurse will adhere to the minimum necessary rule to provide the client's privacy. So things like, let's say you have a client that's being discharged and they need durable medical equipment. They need a walker, a wheelchair, a bedside commode, whatever it is. You can call the DME company. You can give them their name, you can give them their address, and you can give them their insurance information or their payer information. All right. Those are appropriate to disclose to a vendor, right? Because you're not going to be able to get things, if they need oxygen, you need that oxygen there, right? Prior to the client being discharged so that it's at the house waiting for them, or, they'll meet them at the house or whatever. And in order for them to deliver that, they obviously have to have the client's name and address, right? And who's going to pay for it. We look at consent. Client does have the right to consent or refuse treatment. That, of course, is your autonomy, right? Again, it's all about education, right? We're going to give them all the information that they need in order for them to make an informed decision regarding their care. They have the right to choose whether or not they want to accept that care. Oops. So in order for um, informed consent, um, the the informed consent must include their diagnosis or their suspected diagnosis, right? We may not know what their diagnosis is. That's why we're going to do this invasive procedure, right? So that we can get a diagnosis. The purpose and the description of the treatment. This is what we're going to do. We're going to, maybe we're going to do an exploratory laparotomy, go in and look around, maybe take some samples, right? Do some cultures, whatever. What are the expected outcomes, benefits, and possible side effects or complications? All right. The good, the bad, the ugly. Okay. What can go wrong? What can go right? What are, worst case scenarios? They also need to be told what their options are. What are their alternative treatments? If I decide I don't want to have surgery, what other options for care do I have? As well as their benefits, their side effects, their complications. Um, the names and qualifications of the people who will perform the procedure. So if I'm going in to have surgery, then I should be told every person in there. So if it's my doctor and his a physician's assistant or another provider in there, then I should know who is going to be involved in this procedure. Prognosis if treatment is not done. If it's known, sorry. So what happens if I decide that I just don't want to have the surgery or any of the alternatives? What's my prognosis? And then any answers to questions the client wants clarified. Takes 100, takes an hour to answer all their questions, and it takes an hour to answer all those questions. And then we explain to the client that they have the right to revoke written permission at any time. So I agree to have this procedure done. And just as they're wheeling me into the OR, I'm like, oh, wait, snap, I don't want to do this anymore. Change my mind. I have that right to revoke permission. Advanced directives and living wills or I'm sorry, advanced directives, living wills and power of attorneys. So a living will is a document that describes the medical treatments or life-sustaining treatments the person would or would not if would or would not want if seriously or terminally ill. All right. So I'm of sound mind right now. I can make out a living will that says what I do not. Do I want to be resuscitated? Do I want blood products, IVs? I don't know, donations, two feedings, whatever. You can make a whole list of things that I want. A durable power of attorney, on the other hand, is going to appoint somebody that is your healthcare proxy, that is going to make decisions for you should you not be able to make them for yourself. Durable power of attorney is valid in all 50 states. All right. So you're on vacation, you get a head injury, you're unconscious. They're going to call your power of attorney to make those decisions for you. Okay. So you have to be really careful, make sure that you pick somebody that you trust, right, with your life, about these decisions. And then we have a DNR. So a do not resuscitate order is an advanced directive. It's based on the Patient Self-Determination Act that gives a healthcare provider legal permission to write such an order. So you say you want to be in DNR, do not resuscitate, then the medical provider can write that DNR order, which states that should the event that you go into cardiac or respiratory arrest, that we are not going to resuscitate you. You did it. All right, what questions do y'all have for me?
I don't have any questions.
I
I
have
mean,
math questions.
Okay.
I want to go over some of the math. I printed it up. Let me see. Because I always get stuck on the math. Okay, so I was working on one of them. Okay, so the one that you had put inside of the announcement, um, I always get what is it, the kilograms to milligrams. You know that one, like the weight base,
Yep. Give
the
me one
one you
second.
have
I'm
to
going to
do,
pull it up.
the one you have to do the steps.
Hmm.
Price, you know which one I'm talking about?
you
You have
talking
to
about
get,
the weight.
yeah, when you have to do the steps, when you have to do like
Oh,
a
like say for
five
instance, they
steps.
said you got to get it'll be like kilograms per pound. So you have to take like say if the patient weigh like 135 pounds, you would divide that by 2.2. So then that'll be the weight. Then you'll go like it'll be like what is that 45 kilograms? So 45 kilograms times not kilogram milligrams 45 milligrams times whatever you got with the kilograms and times that by whatever the medicine may be or something like that. How many, hold on. Let me see if I can. But it's
Hold
P.
on, I'm pulling it up.
When you pull it up, it's like I think it's question number 9.
Just let it sit
Okay.
let it sit. I gotta go over the math too myself, but I'll do that another day. I just like to keep getting this information.
All right. You said number 9.
Yes.
Ah, okay.
Okay, so it was like the levodopa 4 in
Levofed. Levofed.
levofed 4 micrograms per kilograms per minute for a client who weighs 302 pounds.
Mm-hmm. All right.
So
So I'm going to share my screen. Let me just get this real quick. I'm gonna just flip it over here. I just put it in another Word document. All right, let me share. All right, so this is the question you're talking about, the levofed 4 micrograms per kilogram per minute for a client who weighs 302 pounds. It's supplied as 200 milligrams and 500 mLs D5W. You're going to set the infusion rate at how many mLs per hour? All right. So the first thing that we're going to do is we need to do 302 pounds equals how many kilograms, right? So in
Mhm.
order to determine that, we're going to take 302 and we are going to divide that. Whoops, where did I get the 9 from? I need to put my glasses back on. 302, and we're going to divide that by 2.2, right?
Mhm.
So if I pull my handy dandy calculator up and get a little bit smaller, and come on, there we go. So if I do 302 divided by 2.2, that gives me, whoops, what is it? 137,
137.27 kilograms.
137.27. All right. And then we're going to take the 137.27 and we are going to multiply that by 4,
Oh, okay.
right? Because that's the 4 micrograms per kilogram.
Okay.
And then I'll move my calculator. So we'll do 137.27 times 4, and that gives me the 549. Did she not post the answers? I
I
didn't
didn't look
know.
for the answers.
Okay. I was just curious because I was like, so usually she'll usually post the answers. So,
I get
um,
all the questions, but this one I always get stuck on here. So I got the 137.27 times the 4 micrograms, and I got 549.0.8. But I get
yeah.
stuck right there. I don't know what else to do. I
Okay.
always get stuck.
Okay. So we are working with, so we know that it's the total dose that we want is going to be the 549.08, right?
Hmm.
So that is our desired, right? So it's supplied as 200 milligrams in 500 mLs. So, and it's per minute. So it's the 549 per minute, and we want it at mLs per hour. So give me a second because I'm trying to think of the best way to show you how to do this um, without confusing you.
So
Right.
because it's in micrograms, I gotta turn it over to milligrams, right? So I'll take the 549.08
There you
micrograms,
go.
divide that by 1,000. That'll give me, take that zero, take that over. So that'll give me the zero in front of that. So they give me 0.54908 milligrams, right?
Yep.
Okay. So what I do next?
So then you can use your D over H times Q. Okay. So my D is the 0.54908, right? My H is 200 milligrams. My Q, oops, where's my Q? Is going to be my 500 ml. and I'm using a Word document, so it's gonna, so basically you're gonna do what? You're gonna take
49
0.54908. You're going to put that over 200,
100
and then
times.
you are going to multiply that by 500.
So
So
I
that's how
got
you can set it up in.
0.37.
You can say 1.37.
Uh-huh.
So 1.37, and then I'm going to take 1.37 and I'm going to multiply that by 60, and that is going to give me what I need, right? Because remember, we're going from minutes to hours. So,
Okay.
so then 1.37, multiply that by 60,
It gives me 82.36.
and then we
That
can't get,
round to
there
the
you go,
nearest whole.
which
So
is
take that. I will take that because
It'd be
3
82.
can't go in there. It'll be 82.
Mm-hmm.
very good. Yep.
They did 300.
It's a little bit hard to do it on a Word document, but that was the
Right.
fastest thing that I
Mhm.
could bring up.
So you say, okay, I'm gonna look on my announcements to see if my teacher, I think they did, she did put some math problems in there. I'm gonna go in there and look, because I do need to refresh my math too. But yeah, I'll figure it out. I'll figure it out. I just like to get this information. Because the
No,
more you
absolutely.
hear it, the
I get
more
it.
you remember it. So that's why I like to come to the reviews. Mhm.
Yeah, I like this. I need to do more questions of these because these right here, it get me stuck. When I get to the second step, I get stuck. Maybe because I'm seeing it, actually seeing it. I think I just be going too fast or something. I'm
Right.
actually seeing how I'm doing it because when you said do the D over the H, once I get the desire over the half and then the quantity, it actually made it more sense. I guess I just don't be setting it up all the way.
Mm-hmm.
Now that I actually set it up, now I'm actually seeing what I do. I guess I really be rushing.
Yeah, you
I
can't
need to
rush.
slow down. Okay. Feeling confident.
Okay, well, thank you.
You're very welcome.
Have a good one. Have a good night.
You
Okay,
too.
so we're gonna have our exam the following Monday after this
Correct.
Monday.
Yep.
Okay, that's gonna be in class, right?
Yes.
We'll be back to class. Okay, so you knew that a lot of the ones that were in your class, I think it's me, London, and Chelsea. We had the HESI review for 2 days on ground. Okay, okay. I was just want to make sure that we got our attendance.
Oh, yeah, absolutely.
Okay. All right. Thank you so much. I
Thank you. Have
appreciate
a good
you.
night.
You
You
have a